Much for that. Let's get some expert analysis from the director of the Harvard Global Health Institute, Dr. Ashish Jha. Doctor, thanks so much for doing this. Let's talk about the British drug maker AstraZeneca saying it has started phase 3 trials of its coronavirus vaccine in the U.S. That is good news. This is the third vaccine to enter these large-scale trials. How significant is that development?
I think it's really significant, Jim. First of all, the more that we have entering these trials and conducting these trials, I think the greater the chances that we are going to have a vaccine that's safe and effective. There has been some talk of using data from other countries. In general, the tradition has been for the FDA to see data from our own nation. So I'm pleased that this is the direction in which it's moving.
And the FDA commissioner, I'm sure you've seen this, Dr. Jha, Dr. Stephen Hahn, says the FDA could consider authorization for a coronavirus vaccine before phase 3 trials are over. Is that a good idea?
Yeah, so, a big part of having people take the vaccine, remember, the vaccine itself isn't going to save lives, it's vaccinations, it's people feeling comfortable, is making sure we have enough data to feel comfortable both on the effectiveness and on the safety. And so in general, I have been in favor of completing the phase 3 trials and doing a very expedited review. Obviously, if the data are overwhelming earlier, one could make a case for maybe for certain subgroups getting it. But I think it's incredibly important that we finish phase 3 trials and look at the full set of data before we make any determination.
And Dr. Hahn said the vaccine decision would be based on data, not politics. But I'm sure you've seen this. We've seen the influence of politics throughout this pandemic, how the administration has responded to it, pressure put on public health experts and the administration and so on. How can we ensure we're getting quality science-based information if there is this sense out there that there's pressure being placed on decision makers like Dr. Hahn?
Yeah, so, the good news is that the great scientists of the FDA are still there. And my take has been that we need to hear from them directly, and we need to see all of the data that they make their decisions on openly and transparently. Unfortunately, both in the hydroxychloroquine decision and in the convalescent plasma decision, there was no doubt that political pressure overrode scientific principles. And I think Dr. Hahn may want to recuse himself from the next decision and turn it over to the scientists, or certainly be much more transparent and resist pressure from political leaders. This has ultimately got to be based on science. It can't be based on political timelines.
And I'm sure you've seen this. Dr. Scott Atlas, the new White House pandemic advisor, he's distancing himself from these reports that he is a proponent of herd immunity. How troubling, though, is it to hear these reports, somebody advising the president floating this kind of idea?
Yeah, this idea of herd immunity gets thrown around by a lot of people who don't understand infectious disease, don't understand pandemics. In order for us to have herd immunity in our country from this virus, we're probably talking about hundreds of thousands of more Americans dying, millions more getting infected. It's an unacceptable outcome and an unnecessary one. So to me, it's really troubling. It's not the strategy we've used with almost any infectious disease. I don't think it would work here, but it would cause enormous suffering and death.
Sounds like we need herd intelligence on all of this. Dr. Ashish Jha, thank you very much. We appreciate it. President